Welcome back to Mom in Mind. I'm your host, Dr. Kat. On today's episode, I am talking with Dr. Jasmine. She is a clinical pharmacist with a doctorate in pharmacy and perinatal mental health certified. She is a survivor of severe postpartum depression, anxiety, and insomnia. She's a fierce maternal mental health advocate and second generation Taiwanese American. And she co hosts a podcast called Healing the Tigress, which features conversations about Asian American Pacific Islanders' mental health. She's sharing her personal experience with us today about the postpartum depression, anxiety, and insomnia that she experienced, and in particular, how some of the stigma around medication and mental health um, impacted part of her journey. And even having stigma as a pharmacist around certain medications. And as we talk about in our discussion today, just how important it is to understand and acknowledge and be able to know how some of the aspects of your culture, or in particular being Asian American, how some of the cultural aspects impact our journey through perinatal mental health. So let's dive in and talk with Jasmine. Welcome, Jasmine. Thank you so much for being here.
Thank you for having me, Kat. This is, like I mentioned, such an honor.
Well, I'm really grateful that you're sharing your experience and your perspective. I especially love talking with people who are in helping professions and medical professions because I think there's an additional layer of pressure and stigma. So anytime we can break down those barriers is, I think, great for everyone. Yeah.
Yeah.
So I invite you to start with your story wherever you'd like.
Yeah, sure. And I've said this, I've talked about it a few times. So it's always like, okay, where do I start? And sometimes I cut down things, but we'll just assume maybe people haven't heard it before. And I tend to start with saying that I struggled to conceive and had a very I felt like leading up to having my daughter, life was very, for me, I guess it seemed predictable. Like I had a certain timeline and goals, and everything was sort of checking the boxes until we started to, we were like, all right, time to start trying for a baby. And, the goal was to have a baby within a year, and that didn't happen. So I started seeing infertility pretty early on, maybe like 6 months into the conceiving, just, after every month trying, and realizing that the ovulation strips were not even registering.
Mm,
So I thought there was something wrong, and I wanted to see. And again, since I work in the health profession, people are like telling, giving me advice left and right. They're like, "Oh, just
sure.
just go talk to them now." So yeah, I started seeing them around 6 months in, and the doctor said, "No, just keep trying." And if you started medication, she said, "I may worry you would end up with multiples," um, which for me was not ideal. So
Mhm.
I said, "All right, we'll just keep trying." And a little over a year later, after trying, we luckily naturally conceived. But I think because there was so much anxiety and pressure kind of leading up to that, after I got pregnant, I was really worried about keeping this pregnancy.
Mm,
And so maybe even around that time, the anxiety started building up. But
sure.
I decided I was going to hire a doula that would, support me through the pregnancy and make sure that, everything was smooth with the childbirth, because childbirth was just really scary to me.
Yeah.
And yeah, it was a fantastic relationship with my doula. She actually practices Ayurvedic medicine, which is like an Indian, Asian, like Indian sort of traditional practices.
Mhm.
And the birth was great. Like I felt very empowered. It was a really wonderful pregnancy and delivery.
Great.
But I think where I kind of dropped the ball was I thought that was the end goal: pregnancy, delivery, healthy
Mhm.
baby, done.
Mhm. Right.
On the
Right.
other side of it, I was super blindsided. I suddenly realized that there were all these medical things coming up for me, for my
Mm,
baby. Um, Breastfeeding was super hard. My daughter had latching issues. We took her to see all the consultants. I had mastitis within 2 weeks,
oh,
and it
gee.
was, yeah, it was just, it felt like everything, like a superstorm of things were just all happening at once.
Right.
Um, and and so the worst part started happening when I couldn't sleep. So insomnia was kind of a
Mm,
pretty early on started happening for me. I think it also contributed because I was trying all these things for breastfeeding. I would be like holding her in a position
mm,
for like
mm,
half an hour at a time, or like
right.
this side, and the lactation consultant said just make sure you're like clamped down and just hold her there for the whole time.
Mm.
So I started developing actually arm pain,
Oh
and
gosh.
yeah, and then it was like both my arms would be like tingling. And that made my anxiety worse. So I was like thinking about my hands, like
Right.
physically something was wrong with me too. I couldn't do the breastfeeding. We were triple feeding, pumping, like we were just trying everything under the
Oh
sun.
my gosh. Yeah.
Yeah, and then when the insomnia hit, I think it was actually when my hands started tingling because when I was laying still to try to sleep, that's when I felt it the most. And so my mind would be just like spinning and thinking
Okay.
like, what's wrong with my hands?
Right.
And I couldn't fall asleep. And so it made it worse. I'd be like, okay, please go to sleep. She's gonna wake up soon. She's gonna wake
Mm,
up soon.
mm-hmm.
And
Right.
then it's just that vicious cycle.
It's rough. Yeah.
It is. And so I think the insomnia and anxiety like, combined together kind of drove this sort of like spiral into a depression because
Hmm.
I started thinking that like I'm never going to be normal again. My hands are never going to be like I'm going to be disabled.
Mm,
My boot, like this is not working with the breastfeeding,
mm,
and then just like I'm never going to sleep again. You just start
right.
catastrophizing.
For sure. Yeah.
And yeah, and I know you've talked about like how important that sleep is, and when I hear some of your stories and stuff, and I really think like some people really don't understand when you're trying to explain I can't fall asleep.
Right.
It's so hard to like really drive that in, like how debilitating that is. And so I think
Right. And you
by
could be like so exhausted and still not
exactly,
be
and you
able
can't
to
fall
sleep.
asleep, and
Right.
that's just like what's wrong with me?
Hmm.
What's broken inside of me that I
Hmm.
can't perform a basic human function? So I think a lot of that, superstorm of events made me start to feel very worthless, made me
Yeah.
feel like I was failing at this,
Hmm.
and just kind of like, why did we try so hard to have a baby?
Hmm.
And then, like, this was the result, and I felt like I wasn't doing a good job.
So what's that like the time span you're talking about from like
A
after
month.
birth? Oh,
All of
right.
this was in like the first month.
Yeah.
And then the insomnia, I'd say, probably hit around 3 weeks or so.
Mm-hmm.
Um, and then by like a month in, I decided I'm going to stop breastfeeding. I said, maybe this is just like I'm too anxious about the next thing that's going to happen. Even pumping, like I was sitting at the pump for half an hour, nothing would come out, even though I was like
Mm.
engorged or like just feeling like very full.
Oh gosh.
And I hired like a private consultant to come to my house twice. I saw all the other consultants that were like, in the network, and I just felt like I was throwing the kitchen sink at everything.
Were
And
you in pain too?
yeah, because my daughter couldn't latch very well. So like one side was like if I was pumping, like sometimes blood would come out.
Oh my gosh.
So yeah, I think it was like I just knew motherhood really caught me off guard. I was not expecting like myself to be malfunctioning, my
Mm.
baby to not naturally be able to do this.
Mm-hmm.
And just, I think I never really understood like the whole cycle. Like you're living in 1 to 2 hour cycles,
Right.
and it just feels very repetitive. Like it's just continuing over and over, and there's no end in sight.
Mm-hmm.
And so I think that made that spiral a little bit worse for
Yeah,
me.
for sure.
Yeah. So by my OB appointment, there's 6 week appointment or so, and I want to say my appointment might have been at the 5 week mark instead of the 6 week, just based off of like timing of the actual calendar. Um, when my OB saw me, she actually said, "I think you might want to try an antidepressant."
Mm.
Which I mean, I'd known this OB for many years because I had issues with like cysts even before we started conceiving.
Oh.
So I'd been seeing her for a long time,
Mm.
and she knew me quite well, and like I was just in tears in her
Mm.
office, and she's
Wow.
like, "I think you need to start an antidepressant."
Mm-hmm.
And I think that's the tricky part of like kind of knowing too much about medications too.
Right.
Since I am a pharmacist, I I
Yeah.
was like, no, I was like, I need to sleep. I don't need to be on an antidepressant. I
Mm,
just need to be able to sleep. And
mhm,
I think now that I've started to stop breastfeeding, which I actually just stopped cold turkey.
mm,
So I think
mhm.
that was another issue that I didn't realize the plummet in hormones probably
Right.
wasn't good for me.
Right.
But I felt so desperate that I needed this to stop
Yeah. Yeah.
now
Yeah. Yeah.
that I did that. And because, like I said, the pump wouldn't relieve me, I'd have to put my daughter on, and it would be like very anxiety inducing for me.
Right.
So I was like, I'm just going to stop. I'm just going to stop. And I think that drop in hormones probably made it a little worse. But
Mm,
for me, I thought, hey, I stopped and it's going to get better in a few weeks. So I don't need the antidepressant. I just need this to go away and then I'll be able to figure out what I'm doing and then I'll be
mhm,
solid.
mhm.
But I wasn't.
No.
So
Mm.
I
Okay.
didn't end up taking the medication then. And it
Did you
wasn't.
at sorry, at that point, were you hoping that stopping breastfeeding would help you to be able to sleep?
Yeah, I thought
Mm,
that perhaps that would help me be, less anxious about the whole breastfeeding stuff and feeding
mm,
stuff because
mm,
we would have a little bit more control.
mm,
Um, Around that time, my husband also started telling me, sleep by yourself in like the other room, and I'll sleep in the nursery with the baby and I'll do all the nighttime feeds.
mm,
Uh, but I still wasn't able to really get rest or sleep. And I think that actually made me more guilt feel more like guilty that like he was doing all the work,
mm,
and
mm,
here I
mm.
was given all this time and opportunity and I was still not sleeping.
Did you,
That
what was any part of the not sleeping at that point, anxiety, like
I think
related to
so.
being away from, okay.
Yeah, I think it was partly like anxiety of not doing what I was supposed to be doing. um Even switching over to formula, I would be thinking of things like, how do we make sure this is sterile enough?
Mm-hmm,
How do I make sure I'm measuring this formula exactly?
mm,
And what drove me nuts was when you measure formula, you pour in the powder, then you add the liquid to it, and
mm,
the liquid gets displaced. So it's
mm-hmm,
not exactly two
mm-hmm,
ounces, it's a
mm-hmm,
little bit more.
mm-hmm,
So my husband would say, well, let's make like a larger bottle and split it in half. So we'd have, formula ready to go in the bottles. And I would say, but that's not exactly like 2 ounces. So where do we split it in half or where do we split the bottle? And I think I would just be focused on all
mm-hmm,
these little details. And he's like, why does it matter? Like,
mm,
for me, I think I just wanted like everything to be right and everything to be perfect
mm-hmm,
for my
mm-hmm,
baby.
mm-hmm,
So I think those kinds of things, um, I just felt like I didn't know what my baby's cries meant. I didn't feel like I was bonding with her.
mm-hmm.
And all of it just made me feel like a failure. It really did. And I think that made the depression a lot worse.
Yeah, for sure. That's so much pressure.
Hmm.
And so like everything sounded really magnified,
Hmm.
in terms of the worry that you had,
Yeah.
worrying about details of things. So, did your you said your husband was like, well, it's fine. But did he know what was going on for you, or was that like an internal process?
Yeah, that's a good question. I think I did share a lot with him about like, things I was feeling, and I'm pretty open with my husband. We're pretty close. But I think he just thought it was like, okay, she's just new at this. She's just
Mm,
getting acclimated.
mm-hmm,
I don't know if we necessarily called it anxiety or we called it depression.
mm-hmm,
And I think he knew I was struggling, but we thought we would be able to work through it. Like we would,
yeah.
slowly be able to work through it. Um, until like, I want to say it was like around his birthday. There was this like period of probably 48 to 72 hours where I could not fall asleep. And all I did during that time period was try to sleep. And it's not a
Mm-hmm,
good idea to lay in your bed the whole time trying to sleep.
mm-hmm,
So, those hours and days where I just like, my mother in law came over to help and they were like, oh, just go rest, go rest. I couldn't fall asleep. And I think after not sleeping for that long,
mm-hmm,
I was starting to really like lose it.
mm-hmm,
And he like begged me to start the antidepressants, and he doesn't like medications.
Hmm.
I think it was like either the day before. Memory is kind of fuzzy. It's either the day before or like the day of his birthday or the day after that. Like he, it was like the first time I'd ever seen him cry in my life, and I've known him since high school. So like I've known him a really long time, and nothing really like breaks him.
Hmm.
So to actually see that, I think made me realize, okay, like this is serious.
Right.
Like,
He was really worried about you.
mhm, yeah.
Yeah. Yeah. Yeah. Yeah.
And he's also not one to like to go to the doctor. He doesn't like medications, and he's also like in healthcare, and he's like, so for me to hear this from him
Hmm.
meant like a lot. And it was like a wake up call, almost like, okay, like
Yeah.
I need to do something. Okay, fine. Like I
Right.
guess I'll start the antidepressant. But like in my head, when I was rationalizing it with my OB, it was like I need this medicine. I needed this medicine to work like yesterday, and
Hmm.
I didn't have that time. And I knew antidepressants would take 4 to 6 weeks to work
Right.
at the right dose, too. So it's like
Yeah.
I
Yeah.
don't even know how long it would take to titrate to the right dose.
Hmm.
And it just felt like I didn't have this time.
Hmm.
So I was hesitant to start, but because he sort of like that scared me, like seeing him
Yeah.
cry. And I think that's when I sort of decided, okay, fine, like I do need to start this
Hmm.
medicine.
Hmm.
And it's not like that was it. Like I was cured. I started it and it was fine. It was
Right.
still really hard. Like
Yeah.
it was
For
still
sure.
really hard to struggle through that and find the right dose. And I think I was being titrated maybe a little too slowly and
Hmm.
just being kind of shuffled around, like, the primary care versus like the OB who
Oh
prescribed
gosh.
it. And,
Right.
she said, had suggested I go see like a psychologist. And it, I just didn't really feel like I was really being looked at as a whole
Mm-hmm.
until like after starting it for a while. My husband's like, I think you need to go see someone like, more specialized.
Mm-hmm.
So I finally got a psychiatrist, and the appointments take forever.
Yep.
So I didn't see her till maybe a few weeks after I had started the antidepressant.
And so, how far along in your journey are you
This
at
is
this point?
about her. I met her at about probably 8 weeks postpartum, eight to nine.
Hmm.
No, I take that back. Maybe 10,
Hmm.
somewhere along then. But this was
Somewhere.
all
Hmm.
very like early.
Yeah.
All of this was very early on.
Yep. Yep.
Um, and so my baby was still very young at the
Hmm.
time. I felt like I didn't deserve to be her mom.
Mm.
Like
That's the
just
worst.
yeah, didn't know
Oh,
what I
it's
was
such a
doing.
horrible feeling.
No. And yeah, so when I finally met this psychiatrist, I almost didn't go to that appointment that day. I
Mm.
was like, what is she gonna do for me? And what is she gonna say that no that everybody else has already said?
Hmm.
Right. And luckily my husband dragged me to that appointment. And um, that day I finally felt hurt because
Nice.
after hearing the story and everything, she wasn't focused so much on the depression, anxiety, antidepressant. She told me, Jasmine, I'm going to help you to get to sleep.
Hmm.
And I don't know what that's going to look like. And we may
Hmm.
have to try a few things, and you're going to have to work with me here, but
Hmm.
I'm going to help you find that balance and get to sleep. And
Hmm.
I was like, oh my God, somebody gets it.
Yeah.
Somebody understands that the problem is I can't sleep
Hmm.
and I'm feeling desperate. And I've asked my primary care for all these different options, and I've tried like a laundry list of things. And every time I try something, so I tried like trazodone, I tried a benzo, I tried, and then I refused to try certain things because just knowing too much sometimes. And every time I tried it, just didn't feel like I actually got sleep or I had a reaction. And part of it, when I look back, I think that maybe I was a little too anxious to actually let it sink in or try, because
Yeah.
you do have to give it a little bit of time.
Yeah.
And it would be like 1 or 2 days for me, and I'd be like, nope, tossing that out the window. I
Hmm.
didn't like that.
Hmm.
And I think when I finally worked with her, she got me to sort of like trust her and lean in on her.
Hmm.
But I feel like it's hard to find somebody like that. Like you just don't
It is.
know if you're going to find a provider that's really going to be there with you, walking with you every step of the
Yeah.
way.
Yeah. It
And
is.
I was lucky I had her because we did end up. She ended up giving me Seroquel, like
Mhm.
low doses at night
Mhm.
to at least help me fall asleep.
Yep.
We had a backup plan to have something to, in case I woke up, that I
Mhm.
could take that was more quick acting. Um, and that, along with titrating the antidepressant, finally started to like get some sleep, even if it wasn't like, to me, I'm like, oh, I'm giving all this time. I should be sleeping like 8, 9 hours a night. That wasn't
Uh-huh.
happening. Okay.
Yeah.
It was like I had to take like the 5 or 6 hours and call that a win. But I think in
Oh,
my brain, I was like, no, that's not good enough. That's not good enough right
5 or
now.
6 hours when you've had little to none is a massive.
Right.
It is
And,
massive.
but to me, like at that time, I didn't realize how good that already was. I
Mhm.
still thought that I was not doing a good enough job.
Man.
And that was just maybe my internal critic, just
Mhm.
like,
Mhm.
this something inside of me that someone had to like break it down and be like, look, that's good. Like, that's
Mhm.
actually a good start.
Mhm.
Let's run with that.
Yeah, I feel like that's what I find to be so difficult with anxiety is that it's really hard to allow what the like providers, good providers that you can trust, even to let what they're saying sink in. Because
Hmm.
the anxiety is always like two steps ahead with the what if and the how come and the all of that. So you really have to fight through the anxiety in order to let some of the treatment recommendations
Yeah.
sink in or try them. Um, it's one of the more difficult things.
And that's the thing, is like I knew I was depressed because I, was running through the diagnostic criteria in my own head. And I'm like, I
Hmm.
check every single one of these.
Right.
And when they teach you in school, like, you need to have at least like one or two of these things, and they'd say, anhedonia is a big one.
Mm,
I never really understood what that meant till I was going through it. And it was like, whoa, this is what it means to not feel any pleasure or joy in anything.
yeah.
Like the things that used to make me laugh. Like nothing would make me laugh anymore. It
Hmm.
was just really heartbreaking. And I finally got it. I was like, okay, I am depressed. But I think actually nobody ever told me, you're also you also have anxiety.
Got it.
No one actually really even told me. I
Hmm.
figured this out myself.
Right.
Like as I was recovering and reading all the books and all the Karen Kleiman books, and I was just like, "Oh my god, I had
Hmm.
anxiety too." It was like
Hmm.
it's
Hmm.
obviously they walk hand in hand.
They do.
But to me, I think naming it could have been helpful.
Yep.
Um, it was never named for
Hmm.
me because the depression was so huge. It was very magnified,
Right.
but the anxiety was definitely there. And I almost feel like it was there first.
Hmm. Hmm. Right.
Yeah.
Yeah, I think having high levels of anxiety is depressing. It depletes
Hmm.
you in a way. Like you can only go so long with that level of anxiety without it running
Yeah.
you down.
Yeah.
Hmm. Okay, so how long did it take for you to see any benefit from the medication?
Yeah. I would say probably a month in, my mood started getting better. Of course, I was sort of forced slash recommended to go to therapy. um, so definitely working through that, and making little steps for myself to push myself to go out and just connect with somebody, anybody, like once a week, and find something to do. um, those steps definitely were huge as well. It wasn't just like the medication did everything. It was a part of the plan, but it wasn't the cure all, right?
Mhm, mhm,
But I do feel like by a month in, my mood was definitely better. Um, I think probably by, let's see, let's say 5 months postpartum, I actually weaned off my sleeping medications. And I
mhm,
don't know if part of it was I put some pressure on myself to see if I could get there because my sister was getting married
mhm.
about 6 months postpartum. So I was like, oh, I gotta get ready for this wedding. It wasn't just my sister, it was my sister and my best friend. And it was in the same
Oh,
weekend.
oh,
And they were like
oh
300
my
miles apart.
gosh. Oh,
And
that's
I know everyone
wild.
like going into it was like, you agreed to what? Like, being the maid of honor in the same weekend weddings, like miles
Wow.
apart.
Yeah.
And at first, like when I had my baby, I was like, I told my sister, I was like, I don't think I can be in your wedding. Like, I was like, I
Mhm.
flat out think that I'm not cut out to do anything.
Mhm.
And so to get to that point, it was like, okay, can I get there? And so, like right before her wedding or so, I decided, hey, can we see if I can sort of taper off or taper down the sleeping medications? And I did. I continued on with the Zoloft,
Mhm.
but it was more so like because we had to go to a hotel and like we would have to like be traveling, and I was like just really worried about what this sleep schedule would look like for myself.
Right.
So we even though I tapered off the medication, I have to say that sleep anxiety still lingered for
Mm.
quite a long
Mhm.
time. And my psychiatrist like, "Look, you're doing it. You're doing it every night." I never had to use the backup medicine. And so she's like, "You are doing it." The problem was going to bed, the anticipatory anxiety every
Yeah.
night would still be there. And I think
Yeah.
there was a little bit of trauma from those like
Yeah.
48, 72 hours of not sleeping
Yep.
that just like still stuck with me. It's still with me even tonight.
Right.
Like last night, my daughter woke up because she had a bad dream, and we couldn't get back to sleep for an hour. And I just kept thinking, oh my god, am I gonna
Mhm.
am I gonna sleep tonight at all?
Mhm.
And it's
Mhm.
still there. It's still really hard to get rid of. Um, but the mood and everything was definitely much better as I started like incorporating more things from my old life. I went back to work, and I think even that was helpful for me because um, I was doing something I was good at. Like
Yeah.
I was being, I wasn't the patient. I was being the provider,
Right.
and I knew what I was doing, and
Mhm.
so it felt very like satisfying to
Totally.
feel more in control.
Yeah.
Whereas like at home, sometimes I still didn't know what I was doing as a mom,
Yeah.
and you're growing, and every time you think you got a grasp of something, they change
Yeah.
and they
That
develop
is so
something
true.
different, right? So yeah, I would say yeah, by the end of the year, by like Christmas, I was really like enjoying everything. That was probably about 8 months out or so.
Mhm. Mhm.
And by the 1 year mark, my doctor said, I think we can start to slowly think about tapering you off. So we weaned off in it, and I want to say in total, I was probably on the Zoloft about a year and a half.
Mhm.
Yeah.
Um, so during that time, I know when you were in the depths of it, you've had those feelings of I'm not good at this, I shouldn't be doing this, or like that brand of thinking.
hmm
What do you remember coming out of that and feeling like you could do this? Um,
I feel like there was this one distinct sort of memory. In the beginning when I was just so anxious I couldn't do anything. And the other thing too was just seeing how good my husband was at it. Like he just took over, and he knew what to pack in the diaper bags, and he knew how to like bathe her and everything. And he would be the one giving her baths. He's like, we need to like wash her. And I'm like, oh really? Like, okay, like, do you know how to do that? I'm not sure what I'm doing. And for the longest time I could not give her a bath.
mhm,
So I think at one point, I want to say maybe it was like 4 months in where I was finally like, I finally did it by myself.
mhm,
And I just thought, wow, like, hey, I did that. Like, and around 4 months in was also when I went back to work. So I
mhm,
remember like I went back to work, and then shortly like after, I had like one day where I was by myself with my daughter all day. And I think surviving that day,
mhm,
uh, until my husband got home felt
mhm.
like a sign that I was like, "Okay, like,
Right.
I can do this." Like,
Right.
a lot of it I've seen or felt during my journey was that there's a lot of anticipatory anxiety, but once I actually see myself doing it,
That's right.
I feel like, "Okay, I can do this again." Like,
Mhm,
you just sort of have
mhm,
to rip the Band-Aid off and, like,
mhm,
try it out,
mhm.
and, maybe just not worry so much about every possible, you know, ou outcome that could happen, because I
Right.
think in my head, I'd just be planning, like, "Okay, like, what if I left the house and I didn't have
Mhm,
this or whatever?" And
mhm.
I just I think I read, I think I was it your story where you were saying it would be hard to leave the house because like, just planning everything
Mhm.
would be take up so much brain power that by the time you're done, you're like, I just don't even want to leave the house anymore.
Definitely part of my story, and a
Yeah.
lot of people's.
Mhm.
Yeah, yeah, it's a lot to put yourself through without even leaving the house.
Yeah. So I think every little step where I felt like, okay, this is a new thing and I did it, it
Mhm.
just gave me more confidence that like, all right,
Right.
I think I can do this.
So the other kind of factors that you were dealing with, just in terms of, I don't know, like the stigma, whether it's like related to your profession, or if there was like any internalized kind of like, I'm a pharmacist, uh, I shouldn't be dealing with this kind of stuff, kind of that kind of brand of pressure. What kinds of things were amplifying that feeling of like, I can't do this, or this shouldn't be happening, or something's
Hmm.
wrong?
Yeah. Yeah. I guess I always thought like this shouldn't happen to me because like I should be able to tell all the signs. I should know all the signs, right? And I should have been able to prevent that because, I had a good support system with my husband and, I should have been able to catch all these things beforehand. But um, I think being a pharmacist, like it's easy to like counsel people and tell them to take their medicine, but when
Mm-hmm.
you're on the other side of it, like
Mm-hmm.
actually you being the one taking it, it feels a lot more scary.
Mm-hmm.
And kind of knowing all the side effects, I'm like running through them and wondering like,
Yikes.
okay, I know Zoloft is actually more activating of a medicine. Is that going to worsen my insomnia? Should I be on this one? Should I be on something else?
Mm-hmm.
Um, and just feeling like I didn't really trust my own instincts anymore.
Mm-hmm.
And the other thing too is like the stigma of taking medication. Like I'm Asian American, and my family, even like therapy seems like a dirty word. Like
Mm-hmm.
I'd never gone to therapy before in my life, um, and with medications, even like um, I haven't shared this before. My sister said it's okay to talk about it. So she had sort of had a little bit of depression back in college, and had come to me and asked about like, should I start this antidepressant? Um, and at that time, like, I was very like, "Oh, if you don't have to, like, don't." And I look back now and I'm thinking like, who was I to say that? Like,
Mm-hmm.
I wish, and I mean, she came to me because she knew I was a pharmacist, right?
Sure.
And obviously, like, I'm gonna think about all the bad and negative side effects, but I didn't really know what this medication could do for her.
Mm-hmm.
And I wish that like I had sort of been more understanding. Um, but yeah, like medication to me even was like stigmatized, even as a
Mm-hmm.
pharmacist. I
Mm-hmm.
I was like, no, if I don't have to take the medicine, like I won't take it.
All medication, or in particular for mental health?
I think maybe for mental health, not all
Mm-hmm.
medication. Yeah,
Mm-hmm.
like and so yeah, like when I was talking to a psychologist, she was like, "Would you take a blood pressure medication if you had high blood pressure?" I'm thinking, "Yeah,
Yeah.
like why not?"
Right.
And so why did I have this why did I hold on to this stigma myself,
Mm-hmm.
right? I think I truly didn't actually understand until I was going through it myself that like
Mm-hmm.
and I didn't understand the benefit of what the medicine could actually do for you.
Right.
So, yeah, I was definitely very humbled. And then also just like understanding how it works with the therapy, like
Yeah.
how it
Right.
goes hand in hand. I didn't At first I didn't buy into the therapy either when I was
Mm-hmm.
told to go. I was like, this is just not, I'm like, why am I talking to this young 20 some year old therapist who just finished school,
Mm-hmm.
who like, doesn't told me she never wants to be a mom. I'm like, okay, first of all, that was just a bad fit. And and like now though, I think finally after finding somebody that works well with me, I'm like, this is great. And I
Mm-hmm.
feel like everyone should have this as like a maintenance.
Yeah.
It's like going to the gym. If you're
Right.
taking care of your physical health, you got to take care of your mental health. I really didn't understand that until
Mm-hmm.
I went through this myself.
Mm-hmm. Yeah. Well, yeah, it's hard to know what therapy is until you're in it and feeling it out for yourself and figuring out what type of therapy works for you.
Yeah.
Because obviously there's so many misconceptions about it and misrepresentations of what it is,
Yeah.
and that's just everywhere. But in particular, you're saying within the Asian American community as well. So, like,
Yeah.
what are you supposed to do? Um, that's not how I want to ask it, but like if you're not going to therapy, if you're not supposed to go to therapy, what should you be doing? Like, is there a did you just like suck it up, or do you just not talk about it, or do you go talk to somebody else, like a family member?
Yeah, and that's a good question. Like, when you say like, what are you supposed to do about it? Because I think if you were to ask like my parents or like their generation, it would be like, you just deal with it. Like, this is just
Mm-hmm.
life.
Mm-hmm.
Why do you need to go pay someone to complain about it?
Ah,
Talk to a family member. Just
mm-hmm.
think positive thoughts. That's what they always say. Just
Mm-hmm.
think, or like be grateful. Like, oh, at least your baby is eating well and your baby's not a
Mm-hmm.
NICU baby. And like,
Mm-hmm.
I'm like, these things are not helpful. um, Especially when you're really in the depths of it. Like,
Right.
yeah, sure, I am grateful. And I'm also at the same time, they don't understand what you're actually going through, and it's hard to
Mm-hmm.
explain.
Mm-hmm.
And I think that's the hard part is that because I think a lot of my generation are children of immigrants.
Mm-hmm.
So their parents who came here, a lot of them went through much worse things,
Mm-hmm.
right, to get to where they are today.
Sure.
And so they think that their parents suffered so much more. They burdened so much more. They sacrificed so much more. Like, who are we to complain about this? Like,
Right.
this is like your problem, your
Right.
first world problem,
Right.
But that shouldn't negate or invalidate your suffering and pain,
Right.
right?
Right.
So I think a lot of it sometimes can also manifest as guilt. Like, why do I feel this? Like, how am
Mm-hmm.
I allowed to feel this when my parents went through something so much bigger than what I
Yeah.
did? They came to this country with nothing and they
Mm-hmm.
still built a life and,
Mm-hmm.
gave us everything. And I am privileged in this position today to even go to therapy.
Mm-hmm.
So I think there's a layer of that when I'm thinking about
Yeah.
the Asian American community.
Right.
Um, Definitely, I felt like that for myself. Like, my
Mm-hmm.
parents didn't really understand, like, what is this medicine for? And like, will you get off of it soon? Can you take
Mm-hmm.
it for the shortest amount of time as
Mm-hmm.
possible? Um, and even with therapy, it's like, oh, like, how many times do you have to go? Is that expensive?
Mm-hmm.
It's like, well, how many times do I have to go to the gym to be fit? And do I have to keep paying for this? Yeah, I
Mm-hmm.
think so, or I have to find another way, right?
Right. Yeah.
So I hope that answers the question.
Yeah, I think, I mean, there's so many layers in there. I think in particular, like the kind of the interacculturation parts with immigrant parents, and if you're either first generation here or even like came here when you were very young,
Hmm.
you're straddling different cultures in very different ways.
Yeah,
It's hard to be like an interpreter while you're also trying to get help. Um,
right.
Not language interpreter, like cultural interpreter, and that's what I mean. Just like,
Hmm.
okay, it's this. These people and these providers say that it's okay, even when your parents and or even grandparents might not understand it.
Yeah,
It
exactly.
can almost feel like going against them.
Yeah, I think that is the tricky part of being in bicultural, like this middle
Hmm.
generation,
Hmm.
um, because you want to sort of keep some of the things that your parents brought over and honor that, but
Yep.
you're also not in their same world
Right.
anymore. And it's like your identity is sometimes very confusing.
Yeah.
So I sort of talk about this on my podcast with my story is like when I was when I was postpartum that first month, I did what was called the confinement period, where you're
Hmm.
not really allowed to go out. You're supposed to be drinking all these herbal teas and, following certain rules. And I'm like, I had so many appointments with the doctors and consultants, lactation
Hmm.
consultants, and lab and the pharmacy. I had to leave the house. There was
Hmm.
no way I could stay put and not go somewhere.
Right.
And then all my dad tried making me all the herbal soups and teas and um, trying to balance like the timing of all that with my antibiotics for my
Yeah.
mastitis. Like, it was driving me nuts
It's a lot
just
to
trying to like
manage.
keep up with all of it. So there was another layer of that in my
Yeah.
story that like I don't talk about all the time because it's like a lot of people don't understand like what that is or how that can affect it. But I do think it played a role.
Are you
Um,
talking about the herbs and interactions with medication? Or you
Not
or
necessarily because I
oh,
don't know if they made an interaction, but I think
mhm.
it's just like trying to keep up with
Got it.
both
Yeah.
sides, like what my
Mhm.
Western doctors are trying to tell me and
Yes.
what like my dad thinks I should be drinking or doing.
Mhm.
Um, so that part was like trying to do it all was very overwhelming.
Right.
Yeah.
Yeah, that is like the ultimate straddling of two worlds. While you know, either feel like you don't know what you're doing or don't know what you're doing because it's all new.
Yeah.
Um,
All of it's new. And
yeah.
like if I were to do this again, like, and I mean I'm not because I'm not having another child,
Mhm.
but I would definitely not do the confinement stuff. I would
Mhm.
not do the teas and everything. Just like knowing what I know now, like I think it
Mhm.
would have just been too much.
Mhm.
But of course, hindsight 2020, and this is now coming from my experience. But
Yeah.
I wouldn't have known that like going in.
Oh, right. No, it's really the only way to know is when you go through it. I mean, you
Yeah.
can do all kinds of predicting or planning or hoping, and then integrating that with what is actually happening is quite difficult.
Yeah.
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 So you also said that you're not having any more children. Is your experience part of that decision, or is that just a preference that you and your husband have?
Yeah, it definitely was because of the experience. Um, I had always grown up wanting two children. Like it was like in my head, this was what my family would look like.
Mm,
Maybe because I grew up in a four-person household, and so that's kind of what I imagined. And I'd always gone through life just sort of picturing that until I went through post this horrendous postpartum depression
mhm,
where I'm thinking like is it worth it for me to do this again because I
mm,
finally made it through on this side and I finally feel like I found myself again, and
mhm,
is it more important for my daughter to have a sibling or for her to have her mother present
mm,
here and
mm,
physically well and mentally well?
mhm.
um I had to battle a lot with that. Like it wasn't a decision I made right off the bat. In fact, it probably took me until 5 years like now
Yeah.
until I realized like I'm okay with this.
Mhm.
Um, there was definitely a grieving process
Yeah.
because I sort of had to let go of that vision. But in letting go of that vision, I also came to like think maybe that vision needed to be repainted. Maybe that vision was something society sort of like shoved down my throat a little bit.
Mm,
Um, and and maybe it's okay to paint a new vision. So
yeah.
that was a lot of the work I had to do in the years following this, as I tried to figure out like, do I want to go through this all over again?
Right.
So yeah, I find like a lot of people sort of nowadays are putting their mental health at the forefront a little bit more, or weighing
Yeah. Yeah.
it a little bit more in their decision.
Totally.
And yeah, I think that's totally valid. If you had told me this before I had my child,
Mhm.
I probably would like be like, nah, we'll just push through it. We'll just suck it up. And but at the same time, like now that I've gone through it, I'm like, I feel like I came to the point where I want, and I worked with my therapist really long on this. Like, I wanted to be able to desire a second child for their own unique individual being more than I wanted them to be a sibling for my older child. Like,
Got it.
I couldn't get past that point.
Mhm.
Every time I came back to it, it was like, well, it'd be so nice to have a sibling. Then I'm like, no, no, no. Like, I need to, like, for me, I wanted to arrive at the point where I actually desired a totally different
Mhm.
child. And I,
Mhm.
I just never got there. And,
Mhm.
I think some people do. Uh, but for me, because I never got there, I am finally at the point where I'm like, I'm happy with this. This
Mhm.
is okay. It's okay for my family to look like this.
Absolutely.
Yeah.
Yeah, you're right. There is a lot of pressure. Um, so when are you going to have the next one? And
Yeah.
all of these things. And from family too, friends, family, society, everybody wants to know when the next one is coming.
Yeah.
Um,
Because all they see is the next step. They have to physically see something to
mm,
to make it seem like you're doing more, you're actually
mhm,
accomplishing more. Maybe
mhm.
my accomplishing more is something you can't actually see. Like it's all the
Ooh,
other things I can do because I don't have another child,
that
right?
is, poof, put that on a bumper sticker, t-shirt, like everywhere.
Like I joke with
Hmm.
my co-host that our podcast is like our second baby
Hmm.
because she's also pretty much done having I think she's also like single child, and so we call our podcast our next baby. And yeah, it's these are the things I get to do with I get to pour myself into. Um, so everyone just I think it's okay whatever your family looks like. You got
Right.
to do what's best for you.
Absolutely. Yeah, and it's great that you have somebody that you're working closely with on the podcast and you can share in that a bit.
Yeah.
And so, what are the types of things that you guys discuss on the podcast?
Yeah, so the podcast really kind of came, it was like her idea to start a mental health podcast for moms. And I said I really wanted to focus it on Asian American Pacific Islanders because when I was going through recovery, I felt like reading stories of other moms was very helpful to like see, wow, like I wasn't the only one that felt like this.
Mm-hmm.
It felt like very lonely. Like it felt like I didn't know anyone that was coming forth and talking about this. But actually hearing these raw experiences from real moms was very validating. But after a while, I realized I was searching for the stories of people that looked like me telling about this.
Mm-hmm.
And I just couldn't find very many.
Mm-hmm.
But I was like, I swear they're out there. It must be.
Right.
Like I can't unless I'm the only failing Asian American, but
Oh, oh,
I
ouch.
I
No.
I don't think I buy that. And so a lot of us are, I think, really hesitant to speak out and share about it. So I think when we discussed this podcast, I said this would be a great way to talk about stories of Asian Americans and Pacific Islanders that have gone through similar things. And it doesn't have to be just about like, depression, anxiety. It can be about parenting and how these generational traumas affect our mental health. Uh, we also cover other topics if we can, like, OCD. Um, We've had a guest that talked about bipolar disorder, like her experience growing up with that as an Asian American.
Mm-hmm.
And I feel like these are the stories you just don't really get to hear about as much or see. And like knowing that you're not alone can be so powerful. So
Yeah,
those are kind of the topics that we sort of try to look for.
that's
We've
great.
had dads on the podcast because I think like also men, especially like Asian men, like have a hard time talking about their mental health and feelings.
Right.
So yeah, that's really what the project has been about. It's been very exciting.
So I also think it's so great that you are focusing your podcast in this way because like when we're in our own mental health struggles, it just feels like it's me. I'm the problem.
Hmm.
And you're not thinking like, okay, well, I wonder what like cultural factors are impacting how I feel about myself right now. That's not in there. So and we're not really thinking about how society is impacting us either. It's just I feel bad, so I am bad kind of a thing. So like adding in stories that also have the cultural perspectives and the things that are specific culturally help people realize that, oh, it's not just me. It's
Hmm.
another way of being able to see how many things can be affecting you. One of them
Right.
is cultural and maybe has underpinnings in, like you
Yeah.
said, in family trauma or cultural practices and norms that you're not really thinking about when you're in it.
Yeah. Do you know Divya?
Yes.
Yeah, so she was on our podcast too, and she just talked about how like when you find a therapist that is culturally congruent with you, right? There's
Hmm.
just certain things you don't have to really explain,
Totally.
and that your therapist can just get it.
Hmm.
And I think there's a deeper connection on that level of trust that you can put in this person
Right.
to understand the things that you're talking about and why these things bother you and like
Hmm.
what this really means, like where it could be even like stemming from.
Right.
I think there's something really powerful about that. And also yeah, I think there's this huge um extra layer that from even me, until I actually had an Asian American therapist, I felt like way more comfortable with
Hmm.
her
Hmm.
um, than any of the other therapists that I had before.
Hmm. Right. Yeah, it does. If that's, it does matter if that's what you need. And sometimes you don't know you need it until you have that. it's so anyways that you are now providing kind of support in the way that you are so that people can listen in and hear parts of themselves in these stories is so important. I
Yeah.
wish that this existed for every culture and in every way because
Yeah.
I'm really glad that you're doing this and you felt inspired to do it and you're putting that
Thank
out there to
you.
help other people.
Yeah, I really think that representation is quite huge. And like even for like our Pacific Islanders,
Hmm.
because a lot of their trauma is rooted in a lot of the history of their lands being appropriated and things
Hmm.
like that too.
Hmm.
So I think having the space to talk about these things, a lot of our guests will say, that was kind of like nice for myself. Like
Hmm.
to talk about this with
Yeah,
someone who kind of gets it,
right.
right? And I don't think, I feel like I didn't realize how much of this affected me until I became a mom.
Hmm.
And maybe
Yeah.
that's why like postpartum and perinatal mood disorders um, is such a specialized niche, I feel, or not niche, but
Hmm.
just like topic, because
Hmm.
a lot of people are not taught, even in like medical schools and pharmacy
Yeah.
schools, like we don't get
Yeah.
that education of why this period is so different
Hmm.
than the others. When you're
Right.
talking about mental health in this period
Right.
specifically,
Right.
it's very different.
It is so different. Yeah, I mean, I could go off on
Yeah.
all, we could both go off on all the reasons why we think that nobody knows about this. Um, but with like what you're doing and what we're doing here, and there's, a good bit of groundswell into um, making sure that people do have the information and understand that this is a unique period of time. And hopefully, whatever powers that be out there in medical institutions and um, educational institutions at some point will start adding this into their curriculum and talking about it
Yeah.
so that we don't have to say, why doesn't anybody talk about this? Or
Yeah.
why aren't they talking about it enough?
Yeah. I mean, you've been doing this for so long and it
Hmm.
still feels like it's not talked about enough.
Yeah,
That people still don't understand,
yeah, yeah.
the gravity of this period of time.
Yeah, it's gonna. I mean, I think it takes all of our voices, and the more and more people who unfortunately experience it, but then also go on to do something with their experience that's like public and vocal. Not that everybody needs to,
Hmm.
but more and more people are doing those things, so it's gonna become more of a mm, hopefully a more common discussion.
Yeah. And I think that's what we kind of hoped like Healing the Tigress would do, is just kind of
Hmm.
open up conversations even
Right.
amongst people, even if they're not sharing their stories, but maybe they're sharing it with their friends
Hmm.
and be like, "Hey, like listen to this, and
Hmm.
like maybe I had something like this. Maybe this is what I was going through."
Right.
Because when I started writing about my postpartum depression story on my blog, that's when I had friends come up to me and be like, "Oh my gosh, like I kind of went through that too." And I'm like, "How come I never heard about this from anyone that had kids before me?"
Right.
Because people just focus on the highlights. And a lot of the times, too, it's like, well, it's past. Let's just not talk about it.
Hmm.
But I think for the sake of the future, moms coming in to this, like, I think it would be good that they understand sort of risks and things, and not to scare, of course, but so
Right.
that they're better prepared. Because
Right.
I definitely think I did not prepare for this postpartum side.
Right.
100% like drop the ball.
Mm. Yeah, it's so hard to know what you need to prepare for if
Yeah.
you haven't been through it before. That's why we need other people to tell us that, hey, watch out for this kind of stuff.
Yeah. Well, and some people are also like, well, why should I focus on the doom and gloom, right?
Hmm.
That's so negative. I don't want to think about these outcomes. And
Right, right.
I understand, but it's so common. Like
Hmm.
and it affects even the healthcare providers, right?
Right.
You and
Yeah.
me who should know,
Right.
but it doesn't discriminate.
Mm-mm. Not at
Yeah.
all. Not at all.
Well, I definitely think, like you would be an advocate for, but PSI definitely is huge, and I wish I had utilized more of the resources.
Mm,
I know it's like a broken record telling people about it, but it really is like fantastic. And I have told this story before, but when I was depressed, my sister came to me and said, "Hey, look, I found this website. I think it might have some cool things on it. You should take a
mhm,
look." It was PSI, and there were all these
mm,
free like resources, but I was not in the mind space to dig and find what I could use or do.
right.
It just felt like another one of those, self help things.
Mhm,
Um, but I wish someone had walked me through it
mhm,
and sat with me
mhm,
to go through some of those resources. It's not um, a character flaw to have depression.
right,
There's nothing wrong with you. If this happens to you, it is not your fault. And the other thing is that, like, you really can get better.
right.
And I think that was my the hardest part for me was thinking that like I really had no hope left. There was nothing left for me, that like there was no light at the end of the tunnel, and that I had done this to myself. But no, like there's someone out there that's gonna help you. And so yeah, if you're listening to Dr. Kat's podcast, like this is where you need to be. And yeah, thank you for doing this.
Absolutely. Yeah. Thank you so much for coming on and sharing your experience. I know that it's going to help somebody, if not a lot of people.
Thank you for having me.
You can hear more from Jasmine by going to her blog, pearlsofjasmine.com, or on Instagram at pearlsofjasmine. You can also listen to her on the podcast, Healing the Tigress. And please do share this episode with someone who you think could benefit from hearing Jasmine's story and learning a little bit more about how perinatal mental health can affect people. Thank you for being with us. Until next time.